Good afternoon. Wait, do we need the volume up or not? I can't tell. Good afternoon. Gosh, it's great to see all of you. Good that everybody's sticking around. I know for some of our members, it's a day of going home, and everybody's pretty anxious to do that. So we're fortunate to have a few members here. We may have some on Zoom joining us and some in and out. And then thank goodness for the archives that exist here as well that everybody can watch. But we'll come together today and begin day 2 of our Human Resources Appropriations Subcommittee hearing. Let's start with just a word of prayer. Dear Heavenly Father, we come to you this afternoon with grateful hearts. Help our ears and our eyes to be open to the great needs of our state. Use us mightily in every way that you can. Help us just to pause and to be here in this moment that you have so graciously given us. In your name we pray. Amen. Okay, I'm Katie Dempsey. I think I know almost everybody in the room, but I'm privileged to chair it. I'm going to let the committee members that are here just take a minute and introduce yourself, and we're going to touch your microphone just a minute so you can do it. See if that one works for you.
I'm Karen Mathiak from District 73, which is Spalding, Fayette, and Henry counties.
I'm Tom Kirby, District 114, Loganville.
Tommy Benton from House District 31, which is most of Jackson County.
And
Amber Mack, policy analyst.
Amber Mack is who knows where all the secrets are, okay? She's very important to this process. You all know that, right? Okay, so let's start our day off. First of all, hearing from Dbhdd, Commissioner Fitzgerald, and any of your team members at the podium.
Good afternoon, Madam Chair, members of the committee. Very pleased to have the opportunity to present the fiscal year 23 budget for the Department of Behavioral Health and Developmental Disabilities. I really want to start by acknowledging this particular body's longstanding commitment to mental health. And we are so pleased that your efforts really have brought the mental health conversation front and center in the state of Georgia and lifted up this important topic through the Mental Health Parity Act. And what we know is this has been a really wide-ranging dialogue in the state, but I think what's become clear to everyone is that this is an issue that is of the utmost importance to the people of Georgia. So thank you for being ahead of the curve on that. Let's go to our first slide, Chris. What I want to do, because in that broad-ranging conversation about mental health, I want to actually make sure I'm clarifying what Dbhdd's role is in a very complex public-private service delivery system with a multitude of providers and payers. So within Georgia's complex system, we are the public safety net. So for many of you, this is a very familiar slide. It's a busy slide, but it shows you what the core elements of the public safety net are. They include our 5 state hospitals, the Georgia Crisis and Access Line, and the Crisis Continuum, and a network of community service boards throughout the state. As you all know, our priority population is individuals who are uninsured, receiving Medicaid, and people who are at the highest level of need. I also want to make sure we're clear about our obligation in law to serve forensic individuals. Those are individuals who have become involved in the criminal justice system who are ordered by the court to receive an evaluation, and they may be ordered to be restored to competency. And in fact, 2/3 of our state hospital beds are reserved for this population. So it's a critical role that the safety net is playing. Next slide. I want to show you one more familiar slide, which depicts a decade of investments that you all have led. Even though you can't see the numbers here, you all well know that in 2010, sparked by a settlement agreement with the Department of Justice, we began to make significant investments in community-based services. What you see over the last decade is services in the community that are well beyond the requirements of that settlement agreement. And this is one of my favorite slides that I think is truly a demonstration, tangible evidence of Georgia's sustained commitment to reduce our reliance on hospitals and to build community services across the state. What I really want to recognize here is you all helped to reshape the public safety net and what's available for people in Georgia. And it's been this remarkable infusion year over year that reminds us all both that we have done incredible work, but that we have more work to do. Next slide. Okay, what I've got here is a quick snapshot. You've seen some version of this before, of essential services that were delivered in fiscal year 21. I'm just going to highlight a few of them. Again, it's been our investment in community-based services that has led to a robust crisis continuum that includes mobile crisis services and detox services. We have a model housing voucher program for people with serious and persistent mental illness. We have over 13,000 people with intellectual and developmental disabilities receiving now on comp waivers. And we have on here the APEX program. You all are very familiar. This is our school-based mental health program. In a short 5 years, we have expanded that program to over 700 schools. And I want to share 2 points that I think are really important. 58% of those 700 schools are in rural communities. And of that number of students you see receiving services, 1/3 of those in fiscal year 21 were receiving mental health services for the first time. And I'm taking a moment to highlight all of these services because in the public conversation, you've been hearing a lot about gaps and fragmentation in this complex service delivery system. Those are true. But what is also true is we are, as a result of your support, delivering life-saving services across the state of Georgia. Next slide. All right. Right alongside of those investments in service delivery, I do want to highlight what we are up against right now. It's unprecedented demand across the lifespan. I've shared before with you some alarming national numbers about the impact of the pandemic on young children, adolescents, adults, and elderly folks. But the most important number for us here today is the impact right here we're seeing in Georgia. So the number you see on the screen is a 24% increase in fiscal year 21 in the number of calls, texts, and chats to our Georgia Crisis and Access line. You all are very well aware of the consequences of unmet needs and know that they can be tragic. What I want to be grounded in are the facts and the reality that we do not expect this demand to slow down. Next slide. So, unfortunately, we've got a dual challenge because right alongside this increase in demand that's being seen nationally and certainly here in Georgia, we all know that we have an unprecedented workforce shortage. Now, this is true in every component of our service delivery system. It's true in community-based clinics, it's true in crisis services for our individuals with intellectual and developmental disabilities, it's true in group settings and even group homes. Most critically, what I'm showing you here, though, is the impact it has had on our state hospital system. Even though you can't see the exact numbers, what we're reporting here is that since January of 2020, our state hospitals have experienced a net loss of 1,116 employees. Now, I want to acknowledge Governor Kemp's investment in staff augmentation, which has enabled us to keep the doors open to our hospital system. But I also want to be clear that that's temporary and the impact remains real. When we have shortages, staffing shortages, that means we can't meet the patient's care standards that we are required to meet. So what we do is we take beds offline. And I want to be clear about what that means. That means people in psychiatric crisis end up lingering in the wrong place or experiencing unacceptable delays. And I know you may be hearing about that. You might be hearing from hospital CEOs about people in their emergency department. You might be hearing from sheriffs about people in their jails. You might be hearing about delays in response from the Georgia Crisis and Access Line. All of those are true. We have worked hand in hand with those partner agencies who also are experiencing staff shortages. But what we know is we're in this together, and that we are going to have a concerted and sustained effort to address our workforce shortages. Next slide. So that takes us to today, because I think what the question is how can the fiscal year 23 budget help? Let's show the first slide. Okay, this slide looks familiar to all of you. These are the statewide and agency-wide changes. What you can see here is the biggest ticket item in our budget. It's the increase in pay for state employees. And again, I want to underscore how grateful we are to Governor Kemp for the vital investment in the state workforce. I have heard directly from our state employees in state hospitals in particular, for whom this recognition is meaningful and powerful. We believe this is going to be a valuable tool for retention of dedicated and experienced staff. What I'd like to do now is move on to Dbhdd priorities. Okay, so you may recall this for our Dbhdd priorities. We have this color-coded rubric. What we're trying to do here is tell you what problem we're trying to solve with each budget item. And so I'll just walk through these, and you see that color coding of which challenge that it helps us to address. The first item here is in the category of adult addictive disease and adult mental health. There's a $7.8 million increase to increase core services. Basically, just a reminder, that is basic outpatient services available in the community. And you all have said, can't we do more to address needs before people are in crisis? That is what core services are designed to do. Items number 2 and 3 are in the category of adult developmental disabilities. And you see $1.9 million to annualize the waiver funds that you provided last year, and another $1.9 million for 100 new now in comp waivers. Item number 4 is in the category of adult forensic services. So as I mentioned, this is a key part of Dbhdd's role in the public safety net, where we are evaluating forensic individuals and in many cases restoring them to competency. Most often, this occurs in hospital settings. What's being proposed here is a $2.5 million investment in a pilot program to do this in a jail setting. It gives us more opportunity to reach more people quickly. We can address the current backlog that we have for competency evaluations. And what the hope here is that we can reserve hospital beds for individuals who are most in need. And what we've learned, we do some element of this in our state right now, but in other states, this has been a promising practice to advance and enhance and expedite service delivery. Last item here, again, in adult forensic services, you see a $1 million investment in forensic peer mentors. So let me just describe what a forensic peer mentor is. So individuals who have been in prisons and have been successfully reintegrated into the community are trained and certified to serve in our service delivery system. This $1 million represents a partnership with the Georgia Department of Corrections, and those hired forensic peer mentors will work with individuals as they prepare for their reentry and reintegration. What we know is we've got powerful evidence that when forensic peer mentors are involved, that it has a dramatic impact on reducing recidivism back into the prison, also makes an enhancement of making linkages to jobs and housing. So they've been an important part of helping the prison population as we seek to move people into the community. Okay, next slide. And this is the final slide of Dbhdd priorities in the governor's budget. So item number 1 here, Again, in the category of adult mental health, is an investment of $1.3 million in the Georgia Housing Voucher Program. You all have consistently invested in this program. I'm really proud to tell you that over the last 2 years in particular, we have enhanced the services attached to the housing program to assure that people can stay successfully in the housing. We've also made dramatic improvements in streamlining and expediting the process for people to access those vouchers. What this funding will allow us to do is keep serving individuals at the current pace that we're serving and really stay anchored in that belief that housing is a key component of recovery for people with mental illness and substance use disorders. Items number 2 and 3, again in the category of adult mental health, both reference adding crisis beds to existing facilities. So to be clear, you heard about that increase, that dramatic increase in demand. The fastest way for us to bring new beds online is to increase capacity in a location where we already have crisis services. So what you see here is a $3.7 million investment in our Augusta facility to enhance it from a crisis stabilization unit to a behavioral health crisis center where law enforcement can drop off individuals. You also see a $2.3 million enhancement of our facility in Columbus, where we're going to add 13 beds to an existing facility. These were both high-need areas, and again, allow us to meet that demand in the quickest way possible. Item number 4, in the category of adult mental health, $1.1 million, and this is for reimbursement of case management services. This was a direct recommendation from the Behavioral Health Reform and Innovation Commission with attention to really linking primary care and behavioral health services. Item number 5, once again in the category of adult mental health, is a $4.5 million investment in assisted outpatient treatment programs, what's been known as AOT. And there's been a lot of public dialogue about this. I want to describe just briefly what it is. This is a unique program that specifically targets individuals with serious and persistent mental illness who are not yet successful in their recovery process, and they find themselves cycling in the local community between a hospital or a jail. They simply haven't been able to achieve recovery. So this program is a partnership between the court system and a behavioral health provider. And what we know is you can currently court order someone to treatment, but in order to make that work, you really need the resources, the supports, and you need everyone working in concert in order to make that happen. AOT is an evidence-based program if it is done to the level of fidelity. So that's what is being proposed here, is three programs where we could meet the fidelity standards, and we have some learnings. We currently have a pilot underway with Dbhdd and learning a lot about what's the infrastructure that's needed, what are the kind of staff, what are the team members, how do we partner with the court to make this successful. Final item is direct care support services. Many of you have become familiar. This is in reference to our 5 state hospitals. You see a $5 million investment in capital maintenance and repairs. I always like to take a moment to remind folks our 5 state hospitals are not 5 single buildings in the cities they are in. It's actually about 219 buildings across 856 acres. In many cases, part of an aging infrastructure. So this $5 million is critical to maintaining the environment of care for the vulnerable individuals we serve in our hospital settings, really critical to meet some of the repair and maintenance needs that we have. With that, I conclude my presentation and very happy to answer questions.
Thank you. Thank you for sharing with us what you're looking forward to doing. I know there's some great investments here in the governor's proposal, and the House subcommittee and Committee on Appropriations is anxious to begin to help and see what maybe we can find to enhance all of this. So let's see, let's start with, I believe, Representative Kirby.
Thank you, Madam Chair. Yeah, my question on your employee net loss, 1,116 employees in the 5 hospitals. What percentage of the staff is that approximately? Do you know?
I do not. We can get you that number. I have a feeling Chris is calculating for you right now, or yes. Yeah. We'll answer that one in real time, almost real time.
Thank you.
Yes, ma'am. Thank you, Ms. Chair. Let me ask you, it looks like here what we're looking at is almost 30 million. Now that doesn't include the $5,000 pay raise for each employee. How many employees are going to be in that $5,000 raise? Just curious. Do you know that number?
I have a feeling Chris is going to deliver that shortly here as well. Back to your percentage question, Chris approximated 29% of the hospital.
And Representative Oliver is joining us on Zoom, I believe. We're not getting your sound. Just a minute. Hang on. Okay, let's see. Say something for us a minute. No, is there a chance that your mute button is on at all? Just a minute. If you can hear me, we're trying to figure it out. Just a minute. We're getting in touch with Media Services and see what we can do, because I know your questions will be very important.
I can see Representative Anulowicz says she can hear her.
Yeah.
So.
Try again for us. Representative Oliver?
Yeah.
Okay.
Check 1, 2.
Okay.
Okay, Representative Oliver, if you can log back on for us, we think we've solved the situation.
Representative Donahue, we have an update, and this is a guesstimate, but close on the date this number was pulled. It's for our hospital system only, which is the majority of our workforce. That number is 2,494 who will be receiving the 5,000. Thank you.
Representative Oliver, can we try again for your question?
Can you hear me now?
Yes. Excellent.
I apologize. My computer sometimes will not allow me to do sound, and I've switched devices to phone. Thank you, Commissioner, for all the work you've done to try to help us pull together new possible appropriations that we'll need for possible implementation of 1013 bill, the Georgia Parity Act. I think that's really useful, and as we move forward, I hope we'll have an opportunity to be putting additional numbers in the budget based on what we pass. Let me ask a couple of questions, if I may, about transport issues, because it is a cost right now in a variety of ways, and we're struggling with it in who should pay for it. You may know that the sheriffs do not want to do subsequent transfers once a person has been brought to possibly an ER room and left there, possibly for evaluation, and then afterwards goes to somewhere else. I've been told, one, that your mobile crisis units do transports for subsequent transports to the appropriate facility, and I've been told they don't do transports. I wonder if you could help me understand who is the best entity, if the sheriffs step aside by law, to do transports for people in crisis to facilities.
So let me be clear about mobile crisis, what they're designed to do, and the role that they play. So our mobile crisis teams, which are dispatched by the Georgia Crisis and Access Line, follow the national standards around mobile crisis, which means that they go wherever the individual is, but they are neither equipped nor trained. When I say equipped, they're vehicles that they're using are not meant for actual transport of individuals. They're meant to de-escalate the crisis, identify, evaluate in that setting, whatever the setting is, whether it's a home, a workplace, wherever they go, but they do not do any of the transport, not equipped to, and in fact, most mobile crisis around the country, if following the SAMHSA national standards, would not be transporting patients for safety and other reasons.
In the metro area, there's a variety of different public-private partnerships, I'm told, from a variety of different facilities that are doing transport. Is it possible for you to give us a list of that so we can start working towards a solution on the transport issues and help the sheriffs? Are you aware of these public-private transport issues?
I'm aware, but we'd be more than happy. Any information we have, we'll make available, and we're certainly happy to sit down and have conversation and bring our mobile crisis folks to the table. They're, in some cases, the most knowledgeable, but I think it's a worthy discussion, and we certainly can bring forward any information that we have that would be helpful to the conversation.
Final question, if I may, Madam Chair. Is the
Of course.
APEX money annualized? Do we get the APEX money every year to help with the 700 schools that are participating? I'm confused about that.
I'm sorry, I couldn't hear the first part of the question.
Is the APEX money going to the 700 plus schools for mental health support for children annualized? Do we get this every year in the budget? I'm confused about the annualization. Do we have to reappropriate it every year?
Yeah. Chris is just confirming for me. Most of it is annualized, but not the total amount.
I'm very supportive of this program. I think it's a really important step. So I'd like you to tell us, not now, but maybe when you can, what's missing for annualizing the existing programs to 730 schools, something like that.
Mm-hmm.
I wonder if we're going to fall off the table for how many schools. I'd like to know that.
Thank you. Yeah, we'll be more than happy to bring that information. Thanks for your support.
Madam Chair, I am curious if you know, and whether we can know, or when we might know, all of the folks that are coming to us for assistance financially, appropriately so, but in compelling stories, have they made grant applications for the $822 million that the governor's holding in COVID money? Yesterday I was really thinking about that as folks were making these good cases. Did they make an application, and when are we going to know what the governor's going to do with the remaining COVID money available for behavioral health or human services? Do you have an update on that that could help it?
Representative Oliver, I do not, but we will keep working to find that out. I know that many applications have been made. I know that some people that I've heard from, though, actually did not make the application or get the supportive work together to request that. So while that money does exist, how they are able to distribute it, often lies also on the person seeking the funds. So my own district did not reach out to me for some help, and then I know they're very disappointed for some monies, not necessarily in behavioral health, but in other places that they have not received. And I think it's incumbent upon those who have the need and want to ask also for us to find ways to encourage and educate them about how supportive each of us, just like you, want to try to help.
I just feel, and I've been pestering people about this since last spring, there's money available for a specific purpose, and it seems to be 100% controlled by the governor. And I'd just like to know if it's going to be available to help some of these people we'd like to help. Thank you.
Well, I'll get in touch with the governor's staff and see if we can get an answer for you before we meet again.
Thank you very much.
Thank you. Any other questions from the committee or any members that are joining us virtually? I'm not seeing any, but I've got a couple quick ones, really. You talked about the $1.38 million for Georgia's housing voucher program that's been added in the governor's budget recommendation. How close does this come to truly meeting your current need?
Yeah, thanks for the question. This is a program we're really proud of. This housing voucher program is considered a model program because of the progress that we've made. So as I mentioned, what we believe is that this investment will help us to meet current demand. What the challenge is, what we know is that the Department of Justice is looking to see a sustained commitment from the state of Georgia. So as we think about future demand that's ahead, this will only meet current demand. So there will be future demand that certainly we have an eye towards.
Okay. Also, the 10% increase in core services for addictive diseases and mental health, how will that be applied? Can you tell us a little more about that?
Yes, sure. Yeah. So core services are allocated they'll be allocated statewide, essentially through our Community Service Board network. And really the hope there is that we're increasing access by making more funds available at each of the CSBs. So it will be allocated according essentially to a formula we have that would match their population and their current budget.
Okay. I know you spoke about the jail competency restoration pilot. Did you state, and I just missed it, where it is actually, or do we know yet?
So we are in conversation about that. What we know is it's got to be an area where the size of the jail is large enough to support sort of this kind of unit. So we're in conversation around an urban setting.
Okay. Okay. Well, that sounds really interesting. I mean, I think there's some great hope to be held within that as well. Also, I just wanted to ask you a little bit. I know you touched on workforce and the dwindling numbers and the impacts of that. And we visited a couple of hospitals in the interim, went to see some of the state facilities and heard from the challenges of the workforce there. What do you see right now? I know we've the governor has allowed with some COVID funds to come in and some staffing that has really kept us from being in a much more desperate place. What do you see the real shortfalls? Like if we were to say, okay, tomorrow, open up the beds that are not, do you have any idea how short we are on true people that deliver services?
So we get a regular report of the beds we have offline. So we can't bring back beds online until you have the full staff complement, right, in order to do that. So if yesterday we had 140 beds offline across the hospital, that's just the hospital system, not including the crisis system. When you think about bringing the beds online, that means at every level of staffing. So you need to have the front line, what we call our service technicians, health service technicians or forensic technicians. You have to have the nursing, you have to have the doc coverage, social workers. So it's sort of all the roles in the hospital that come together to really provide the level of patient care that we want to and are required. So it's really a collection of all of those positions that really make hospital care possible. Of course, what folks know is the nursing shortages in particular really are probably among the most challenging that we face.
Well, I know we've talked over the last year or so and just the challenge in this, and that is heartbreaking. I know that there are beds, there's facilities, they're ready to accept, but not having a workforce and how we figure out ways to really and truly, meaningfully, and with fidelity, as that word is used, develop that workforce and put them in place. It's not something that can just happen instantly, right?
Yeah, and you got to hear this directly from our team members when you came to visit, and it was so appreciated by them. And I think the thing that a lot of people took away, the people that are there are remarkably dedicated, right? They're not there for the pay. They're there because this is a mission they want to fulfill, but we do need support in order to bring those beds back online.
Well, I appreciate all that you have done, and I know the conversations that we had when we worked on the amended budget as well, that the committee truly appreciates the work that the department and everyone that's working there is doing to help guide us through this unique time where not only do we not have the workforce, but the needs are continuing to grow and at times be somewhat surprising to people that are not fairly invested in the long-term care that y'all are delivering. So thank you. Thank you for all you're doing.
Well, thank you. Your interest and support is greatly appreciated.
We appreciate you.
Thank you.
Okay, thank you. And next, we will hear from Veterans Services, Commissioner Patricia Ross, and anyone else from your staff that you feel needs to.
Thank you, Madam Chair and members of the committee. Very grateful to be here today, and I appreciate you taking the time out for us. I think we've got, getting up our slides now. Sorry for the delay.
Waiting for this too as well, that there is a sign-up sheet back over here on the last row. Anyone who's here that would like to speak that has not signed up, please do. We're here to listen, so let's hear. Just make sure your name is on there.
Okay, I think we're ready to go.
Great.
Next slide, please. Just to remind y'all of our mission, I'm not going to go in depth like I did with our amended budget to go into a lot of detail about what we do, but we do assist almost 700,000 veterans, and I do have to caveat that. Those are only the folks that have signed up for VA Health, so that number is much larger. We just don't know what it is, but we're anticipating it's closer to 1 million veterans. Here. We also provide, of course, skilled nursing through our two nursing homes, as well as national level memorial benefits, similar to what they do at Arlington. We're held to the same standards in 2 cemeteries here in Georgia. So those are our primary missions, and I'm going to just jump into the budget if I can. Looking at Section 48 overall, you can see that what our state funds are just over $25 million, and I'm going to go into those into a lot of detail. So next slide, please. Basically, what this slide is in our administrative program is the $5,000 increase for our employees, the cashing in of leave, additions for ERS, GSEPs, and then of subtractions due to DOAS and TeamWorks adjustments. Nothing significant on that slide. The next slide, looking at our memorial cemeteries, again, is that $5,000 raise, of which, of course, we are very appreciative of, and then plus ups for ERS and GSEPs. The following with our nursing homes, that also is plus ups for the $5,000 pay increase. Again, to remind y'all that those are very few of our direct employees. The majority of that is going to Augusta University, who is the contract carrier for our Augusta home, who, by the way, just went through an inspection and did very, very well. We're very proud of them. And to the next slide, veterans benefits. What I do want to cover here, I've talked about the additions and what the adjustments are in our budget, along with all of our other programs. But that very last line, we had asked for a additional field service officer in Pickens County for the Jasper Clinic. Just so you know, we do our best to partner with the Veterans Administration to put our personnel where the veterans are in those community-based outpatient clinics. We've taken a look overall at where we have our people, what we can do more efficiently, and we have no issues with that. Just so you know, it's not only the Jasper Clinic, but Cobb County, which is due to open in June, and Pike County, one in Zebulon. We're able to accommodate those 3 additional field service officers by realigning some existing positions, so that would be of no cost to the state. We've found those internal efficiencies to cover not only that position, but 2 additional ones that will be coming up this summer. I wanted to point that out. If we go to the next slide, and this is where I'd like to sit for a little bit. As the brand new commissioner, I looked at the priorities we submitted for FY23. We submitted a total of 8, and really only 3 remain. After evaluating what our internal capacity is to absorb some of this, so a couple of the things, a reclassification of directors we can handle with the proposed budget increase. As discussed, we can already absorb that additional field service officer in Jasper and Pickens County, annual training, as well as a system we use to account for our interactions with our veterans. That accounts for about $235,000 we had asked for with the FY23 budget that we're able to absorb. However, there are still 3 requests that we would like to discuss, and one based on the calculation of that $5,000 raise. So if we go to the next slide, bottom line is, with that point in time count at the end of the fiscal year, we did have additional vacancies that we have since filled or are filling, a total of 14. And what we would request is that $5,000 raise be given to those individuals that have been hired since then or will be hired before the end of this fiscal year, so that there's equity in pay. We are one of the lowest paid state agencies. Our starting salary is $27,000, which is about $20,000 less than the other states here in the Southeast. And so we would like for that $5,000 to also go to any of our new employees that have been hired or will be hired in the future. And we've done some efficiencies within the department, as well as some reorganization to better serve our veterans. A couple of things just to highlight, not necessarily on this slide, but just so you know, we're taking a real hard look at this. We've moved 2 appeals officer positions from Atlanta. We now have one in Central Georgia and one in South Georgia. That allows our veterans to not have to travel to Atlanta to do their appeal hearing. That better serves our veterans and also enables us to put more folks out in the field. We've done the same thing and created some district managers, both in the North region and the South region, which allows us to do more of the administrative work as well as build the bench for our more senior positions, and enables that veteran, if they have an issue or if we need to do on-the-spot training, we've got more folks out in the field that can do that. We've done that all internally with our own budget. We did have some significant vacancies, which I'll touch on in a minute, but the bottom line is this $112,700 would allow us to retain the folks that we have already hired and attract the talent and have equity in pay with everybody else that is getting that $5,000 increase. If we go to the next slide, this was our first priority when we presented our FY23 budget, so now it kind of drops to 2, but it's still getting a pay raise for our lowest paid employees. We're asking for an additional $3,000. You can see where that's spread out. Just so you know, we along with everybody else has had that great resignation within the last few months, specifically looking at December and January. We lost 26 employees, and I realize if you're an organization like Dbhdd, that's not a large amount. That's 16% of our population of the people, our employees. Routinely, we have about a 40% attrition rate within the department. So it's going to be higher this year than it ever has in the past. What that means is when you take our requirements, so we are trained to the standards of lawyers to be able to be accredited by the VA to file claims. We have 1,000 hours we have to train somebody before they are an accredited, what's the word I'm working for, field officer of being able to submit claims. What that means is that 1,000 hours is individuals from our training team, their supervisors, their regional managers taking time out to do that training. We estimate those, just that training cost to be about $20,000, just the time other people spend to now train our employees. And then that's also time that those supervisors, managers, regional officers can't help fellow veterans. So it's taking away from their primary mission where they're constantly having this churn and having to train folks. If you just do the math saying that we're at our same 40%, that's almost $800,000 we're spending just in manpower cost in training because of this high attrition, which is why we're trying to get a not quite parity with our other states here in the Southeast. Because if you look at what Florida, South Carolina, Mississippi, and North Carolina, I've spoken to all of their directors, they actually pay about between $41,000 and $45,000, and what we're asking is to get our employees up to $35,000, about $10,000 less than our fellow states. But that will do a lot to, again, help us attract and retain talent, puts them at about $16.82 an hour. Interestingly enough, it's about the same amount that we were cut in 2020, almost by the dollar. So with restorations of that cut, we could fund this raise, better serve our veterans, and actually bring in more money to the state of Georgia if we keep employees and they're helping to serve our veterans. And I'm going to touch on kind of our impact in a minute. Priority 3, what we're asking for here is an additional position. This is something we can't do within our existing budget. It's in our admin line where we have no flexibility. The governor back in 2020 signed the governor's challenge to help prevent veteran suicide. We've been doing this as an additional duty with one of our staff members. Honestly, it requires full-time attention. So it's not only dealing with state agencies, but federal organizations and SAMHSAs. We can hold the monthly meetings as required, but we can't do much more to stem the 22 veterans a day that commit suicide. It's being able to do outreach to connect with other organizations, community-based organizations, healthcare providers, to get these veterans the mental health services that they need, and that takes somebody dedicated full-time. So that is our third priority and would cost us at our director level position about $114,000. Going to our next, which was our fourth priority, y'all were so gracious, and I thank you for the additional cemetery worker you gave us from Milledgeville last budget cycle. We need actually one more in Glenville. So as you can imagine, we've had a significant increase in interments in our cemeteries, and while COVID numbers have gone down, we believe that we will continue on the upswing, mainly because so many more people know about our wonderful cemeteries. It is a great benefit. And again, if you go to see them, they do look like Arlington. Same standards are kept. But these cemetery workers, although they're classified fairly low as grounds maintenance technician, that's very little of what they do is actually do grounds maintenance. They're heavy equipment operators, which typically prices out in the high $20 an hour. In addition, they do the interments, they help set up the burial ceremonies, help get ready the facilities, actually, do everything. So that to be able to keep up with our current demand and what we project as our future demand at Glenville, we are looking to add one more worker. And just so you know that funding line gets them just about $15 an hour. So it's not a significant cost. If we could go to the last slide. So this is just a sum. Our total request is $930,000 just for you to consider. But I have to kind of put this in perspective. Last year alone, we brought in $3.3 billion, and I'll repeat that, $3.3 billion that was directly attributed to individuals within Georgia Department of Veterans Service filing claims with the VA. So that's money into Georgia and into veterans, their survivors, into their pockets, directly affecting our economy. So if we look at just what that return of investment, if we had these additions, that basically gives you $123 to $1 you spend. So to give you some additional numbers, and I know I probably should have put these on the slides, but we just kind of generated these because I asked the question. So we do have almost 700,000 veterans here in the state per those enrolled with the VA. But almost 250,000 of them reached out to us last fiscal year. That's how many people we touched in one of our field offices. So that's a tremendous amount. We supported over 400 veterans within our homes and then did almost 3,000 interments. So all told, we directly impacted another 7,000 veterans in addition to that 250 we saw in field offices that we did claims for. So what we do not only brings in money to our veterans or their survivors, but it impacts lives. Let me give you just a short story. I actually was involved with a widow who had come in. Her husband had been denied benefits for his service in Vietnam and actually died of cancer due to Agent Orange exposure. Came into one of our offices, and she was on the verge of being homeless, was working at the local grocery store on our military installation bagging groceries. She is 80 years old, bagging groceries to earn enough money to live. We relooked the documentation. They actually brought it to me, and I saw, based on his orders, he was actually assigned to the country of Vietnam. The VA had just overlooked it. So we refiled, and she ended up with a retroactive reward of $100,000. I mean, that changed her life, where she could quit working full-time, was not worried about where she got, her money for food or for rent. That's just one story. We've helped those on the verge of homelessness or that were homeless. It's a significant amount of money that is brought into Georgia veterans' pockets, and we're very proud and very honored to do this mission. So, pending any questions, that concludes my presentation.
Are there any questions from the committee? Okay. Representative Benton.
You said in your presentation that you lost so many employees. Were those poached by another agency?
Yes, sir. And the number one reason, so we did exit interviews, was because of the salary. They went to other veteran service organizations, and I hate to say it, Department of Labor. They were paying them $20,000 more than what we were paying.
And it was a state agency that was
Yes,
paying
sir.
more than that?
Yes, sir.
Okay, thank you.
Any other committee questions? How about any online at all? Do we see? Not seeing any. Let me ask you a little bit. A couple
Yes,
of
ma'am.
things that you spoke to that I know the work that we do here really does focus a lot on suicide, substance abuse, and homelessness. And I don't want to assume anything, but are you seeing those numbers grow in the work that you do right now?
Yes, ma'am. Specifically, not necessarily in suicide. So unfortunately, the numbers only go back to 2019 for veterans. And there was actually a decrease in veteran suicide from 2018 to 2019 by a small margin. But we do believe with COVID and issues with isolation that those numbers have increased. We just don't have national data. But I can tell you, especially being located here, we've seen an increase in the number of veteran homelessness. Part of that is due to affordable housing and the housing market just booming and individuals not being able to afford to get into that market. That is some of the anecdotal evidence we've been given, but we've just met many more homeless veterans. And so part of what this, I know it's termed the suicide prevention, but it's also an outreach coordinator that would go out to connect to all these agencies. And we do actually have a grant in with several other state agencies to collaborate to create a system that would connect folks that are homeless, folks that have substance abuse, mental health issues needing employment, et cetera, for veterans as part of what the governor's considering under the American Rescue Plan, or we're just awaiting word as to whether we're going to receive that grant. That is a technological solution that will allow us to connect actually the entire state to a platform to be able to provide services to veterans and their families.
Thank you.
You're welcome.
Thank you for looking at that and preparing. I do not see any more comments, so thank you for the work that you and your team are doing. We appreciate you.
Thank you very much. We appreciate you as well. Thank you.
Okay, so next, the Georgia Council on Developmental Disabilities. The Executive Director, Eric Jacobson.
Madam Chair, members of the committee, I don't have any slides today because we only have 2 line items in the budget. And if you look under Dbhdd, those are line items 15.12 and really end at 15.12.3. So there's only 2 issues really within our budget for us to discuss today. The first is that we have $500,000 for the continuation of our IPSE program, our Inclusive Post-Secondary Education Program, that you all were so instrumental in making sure is available throughout the state. We are currently at 9 programs. We lost 1 this year, and we expect 1 to come online next year, but we're at 9 universities. We currently have 136 students enrolled. 54% of those graduates are employed within 90 days after graduation, which is a very high employment rate, especially as it relates to individuals with developmental disabilities. So when we can get 59%, we really look at that as a positive impact. That's line number 1. The second line that we have in the budget is our change, and that is $12,125 to provide staff salary increase on the $5,000 for 1 staff person, and that's because only 1 of our staff people actually receive state-funded dollars, and that's actually the person that runs our Inclusive Post-Secondary Education Program. So the remaining staff are federally funded at this point. So that's our budget in a nutshell. I want to take a second to reiterate what Commissioner Fitzgerald said, and really thanking all of you for your work over the years. I am here to announce that I'll be leaving the council at the end of May after 30 years, and without your all's support and really on a wide variety of issues, we wouldn't be seeing the changes in Georgia that are taking place. So I want to thank you for your continued support and working with us over the years to try to address the many issues that exist. I will tell you that the 100 new waiver slots in the now and comp, I'd be remiss and my staff would yell at me if I didn't say that's not enough. That, in fact, I did a quick little look at your all's districts and found that other than the folks that are in DeKalb and Gwinnett, there's a total of about 415 people for the rest of you that are on the waiting list right now for home and community-based services. If you add in Gwinnett and DeKalb County, that makes it about, what did I say, 14,000, I believe is the number. 1,900, excuse me, if you add in the 2 larger counties. So that's $1,900 just, or 1,900 people just amongst the people that sit on this committee. So I want to thank you again for your support, and I'll be more than glad to answer any questions you might have.
Thank you. Thank you for sharing with us that tough news to hear, Director Jacobson. Thank you for the work you've done over all these years.
Thank you.
Are there any questions or comments from the committee? Online?
I think we're good.
Okay, well, not seeing any, I do want to go to talk just a little bit about the now and comp waivers, because it's a discussion that we have every year, every budget cycle, actually. So the planning list, we know there has been growth in it.
Yep.
Do you, are you suggesting any anticipated growth in that? I mean, are you seeing the cycle that we might be in, that there will be even more people in the next few years needing?
Well, if we only fund 100 a year, and we can anticipate that we've grown about 1,000 just in the last year and a half, we anticipate that that number continues to grow. And if we don't address it in a significant way, then that number will continue to grow, and I don't anticipate an end to it anytime soon unless there's significant dollars and resources put in. And I would also be really remiss as well if I didn't talk about the fact that folks on the Now and Comp are also seeing the same kind of direct support staff shortages that Commissioner Fitzgerald talked about in the mental health field. And so that makes it even more difficult, because even if we get somebody a waiver, it doesn't mean they can find the supports they need. So we have to be, I think we have to balance those two issues there.
So I would hope that as you leave the day-to-day work of what you're doing, that you'll continue to keep thinking about this and continue keep advising us. And,
Absolutely. Be my
when
pleasure.
you have more time to be creative,
Yeah.
maybe you can send some good ideas forward.
I have lots of ideas just waiting to come out once I'm gone from this position.
Well, you're going to have time to
That's
work
right,
on that
that's
too,
right.
so that will be great. I look forward to that. Representative Benton.
Thank you, Madam Chair. On the Now and Comp waivers, we have all these that are being added. Do y'all go back and look at any of these that are already on the list to make sure that they're still around, or?
That was done, I believe it was 2 or 3 years ago. They did a complete purge of the list, and they went through every name, and they looked for where there were duplications and where, I might have applied and then I passed away, or I moved, or whatever it might be, and they were able to reduce it by about 2,000 people at that time. But even since then, now it's grown above where it was when they did that purge.
I've been on this committee a pretty good while, and I've come to the conclusion that we won't ever get to the end of it. We can't come up with enough money to fund all these, especially the comp that are so expensive. And what do you think about every year making people reapply?
I think that would be a waste of some people's time, because they're
Well, not if they get the waiver, it
well,
wouldn't be.
I guess what I'm saying is their disability doesn't go away.
Well.
So their disability is there, and so it would just be a matter of they would have to continuously prove their disability, and I'm not so sure.
What are they doing now before they get the Now and Comp waiver? What's happening to the person that's disabled?
Well, a lot of people are at home, and they're not doing anything, and they're not getting the supports they need, and mom and dad aren't getting the supports they need either. So those are the folks that we hear have the greatest needs.
Okay. It seems like that we are bailing a boat that's taking in more water than we have the capacity to handle.
Well, we've been lucky in society that people who used to die at a relatively young age are now living much longer, so therefore they need supports longer. People that might have died in childbirth are now living through through those traumas and are requiring supports as well. So I think I think almost like a catch-22 in terms of we've done really well as a society in improving healthcare and improving life outcomes, and at the same time we got to provide those supports for the people that have survived.
Okay. I got some other comments about that, but they might be too controversial.
Well, I'm in plenty of controversy right now, so.
I understand. And you see what we're sitting up here, and we fight with this every year.
I know.
We come up with more money to fund more than what the governor is recommending, but yet it seems like that we're trying to drink from from a fire hydrant, and at some point people at home are going to have to do a little bit more than what they're doing. Thank you.
Thank you.
Thank you. I'm not seeing any other.
Great.
But
Well, thank you again for all your support over the years.
Appreciate you. Okay, we are going to start taking comment also now from some of you that are here, some that are online. If you did not get to sign up, if your name is not on here, I'd like to encourage anyone to come up and do that now. Hopefully we have everyone in the room, because I want to be able to hear you. So let's get started. Our first presenter is on Zoom, I believe, and it is Brittany Luther Jones with the Bradley Center.
Everyone, Chairman Dempsey, subcommittee members, thank you so much for the opportunity to be here and speak with you today. Specifically, I'd like to speak on the fiscal year 23 budget and the Department of Behavioral Health and Disabilities portion of that budget. As you mentioned, my name is Brittany Luther Jones, and I have the distinct privilege to be here representing the Bradley Center today, respectfully asking you to support the funding of lines 1548 as well as 15412 in your tracking documents. Excuse me. As I mentioned, we're extremely grateful for the funding that's already been placed in those lines to increase the additional crisis beds in our community, as well as the support of the assisted outpatient treatment programs, which we too hope to participate in a pilot program to support our community. We know that these items will certainly go a long way to address the mental health crisis that you all are very aware of and have spoken on repeatedly in this session today. And we hear asked today that what we have in the budget, although wonderful and absolutely appreciated, does not quite meet the need of our facility and of our community. Our needs have grown, as you've heard everyone else say, in terms of the resources for the individuals, their care that is needed, as well as the workforce shortage and crisis that we're experiencing in our community as well. We do ask that that increase be adjusted up to approximately $750,000 to cover what we have estimated to be the true cost of care for funding those additional 13 beds, which are absolutely so needed for our community. Our facility operates crisis beds. We're not the only private partnership in the state to do this work now, but we are a very small set that operates in concert with the department and not always directly under those lines of control and contract. We are requesting this to expand that service line. Of note, we do serve a community that is urban in nature, but also are the catchment for a large portion of Southwest Georgia. Over half of those counties lack access to psychiatric beds as well. So we support the Muskogee County community, but we also support all of the Chattahoochee Valley and Region 6 in these outpatient services through our crisis stabilization unit. As you're also likely aware, we are entering into a partnership with Mercer Medical School, as well as operationalizing psychiatric residency here in Columbus over the coming year. We know that this funding will allow us to attract talent to stay in this community and to better serve these individuals as well as we grow those service lines and really position this area to be able to take care of the community needs that are before us and are going to continue to increase with the changes in the mental health legislation to come. Of note, I would like to leave you with a few statistics about our facility. In 2021, we were able to provide over 1,000 admissions to crisis stabilization. And we were also one of a very small subset of CSUs that were actually able to stand up full COVID care of individuals in our community. Not that we were able to do one or two, but we actually established an entire unit where those medical and psychiatric needs could be met at the same time. We provided over 7,000 days of care in crisis stabilization and also managed to keep an average length of stay to about 6 days. And this is important because we're efficient in our care and also allowing for those individuals who are waiting for care to be able to be served by our facility very quickly. We have a distinct benefit of being surveyed by the state over the last several months and continue to receive high quality rankings, high markings for the care that we give, and are just very proud of the services that we're able to provide. We'd welcome the community to come and visit us, to learn more about the Bradley Center, to invest and learn more about the assisted outpatient treatment opportunities here, and certainly appreciate your consideration for the additional funding that we need to fully support this, but are absolutely grateful for the funding that has already been provided and your support today. Thank you.
Thank you. Are there any questions or comments from committee members? Online, I believe we have one. Just a minute. Let's see. From Representative Oliver.
Thank you, Madam Chair, and thank you from Columbus. Appreciate it. Would you comment a little bit on how transports are handled in your region for 1013s or crisis folks being brought to your facility?
Yes, ma'am, I can certainly comment on that. We do have a variety of mechanisms in which individuals reach our facility. We do have direct cooperation with our law enforcement officers where they can present them directly to our crisis stabilization unit for 24/7 evaluation. We also provide through St. Francis Hospital, this is unique for us in partnership with our hospital, and it's certainly an expense that we incur outside of maybe the norm for other crisis stabilization units. But for individuals who present to our emergency department in need of crisis care, we also assume the cost of paying for private transportation through a security firm. We found
that's very, very helpful. I'd be grateful if you'd send me and the chair an email about a little bit more information on this public-private partnership for transports.
I'd be very happy to.
It'd be very helpful. Thank you.
Yes, ma'am. Thank you.
Okay, I am not seeing any other comments or questions, but I want to say thank you so much, Brittany, for the work you're doing and the work that you've persevered with through COVID as well. Thank you.
Thank you, Madam Chairman.
Okay, next also joining us on Zoom is Deanna Julian with ARC Southwest. There, yeah.
Thank you, Madam Chairman, and thank you, committee members, for staying here and being here on this late afternoon. I'm a little bit like Mr. Jacobs. I would be remiss if I did not talk about some of the challenges we face with our intellectual and developmental disability community here in Southwest Georgia. I'm Executive Director for the ARC of Southwest Georgia, formerly Albany ARC. We've been serving individuals with disabilities in Southwest Georgia since 1963. We have an unwavering dedication to civil and human rights for people with developmental disabilities, as well as provide support to individuals, almost 600 individuals across 15 counties. We do provide the now and comp waivers, and it is one of our largest priority needs here in rural Georgia. The funding of additional waiver slots is crucial to the survival of people with disabilities and their families, and we appreciate that additional funding. Yet, as Mr. Jacobson said, it's not enough. In this political climate of proposed budgets, Georgia currently still has over 7,000 people on the planning list and waiting list for services, and the current lack of resources and supports leaves families with nowhere to run and nowhere to turn. Family caregivers experience at least one change in their employment status due to the needs of a loved ones, which leaves them with their ability to work and to become contributing tax-paying citizens. We know that family caregiving causes mental and emotional stress and strain, contributing to the current mental health crisis. We know that our direct support professionals and others in helping professions experience fatigue and burnout. There are many causes to this, but inadequate pay for challenging jobs and working multiple jobs to make ends meet is certainly one of them among our DSP Workforce Crisis. We here at the ARC of Southwest Georgia are experiencing a 49% turnover rate, along with 26% decrease in staff and almost 3,000 hours of overtime per pay period, which is almost $1 million impact to our budget. We know the pandemic has caused burnout for all workers across all industries, but the healthcare and professional care industries have been hit with a devastating force. State employees are not the only ones in dire need of salary increases to maintain retention and quality workforce. The need to address the support of individuals in our developmental disability community and their families is at its most crucial intersection. I understand that Dbhdd hospitals are in crisis, but they currently have a number of beds offline due to staffing shortages, and community-based services and with our families, we cannot take the people we support offline. So they are often left with minimal support or none at all. We have had to turn individuals and families away due to a lack of resources here in Southwest Georgia. We know that those with disabilities left without supports are also very likely to experience mental health issues contributing to our current crisis. The ARC of Southwest Georgia also has a child development center for children ages 18 months to 4 years old with developmental delays and autism, as well as collaborations with local school systems and our APEX programs. The current mental health crisis and our opioid epidemic is influencing a spike in children with developmental delays and an array of intellectual and physical disability diagnoses. The current environment is only going to continue to contribute to an increased need for adequate IDD services as well as mental health services in our state and across our region. If our state does not support all disabilities as a whole, along with our current mental health crisis, we're going to see a true avalanche of failing services in our most vulnerable populations. One thing we are asking to look at is the Dbhd's Family Support Program that allows families to have at least up to $3,000 for medical services, for personal supports, to help support some of those individuals on the wait list. We understand that there are 7,000 people on the wait list, and at $3,000 per individual, that's almost a $21 million increase in the budget. But if there could be a percentage of that to help some of these families that are being left with no supports at all, it would be a huge asset to our state and our mental health crisis as a whole. And thank you for your time and consideration. We appreciate the job Commissioner Fitzgerald and others are doing to really support those with disabilities across the state, along with our mental health crisis. But we have asking for some focus with our developmental disability population as well.
Thank you so much. Very familiar with the work you're doing and the work that's been done over the years, so we appreciate you very much. I am not seeing any comments or questions right now. Do we have any online at all? No. Great presentation. Thank you for updating us and informing us, and we'll certainly be taking a lot of this in consideration as we work on the budget.
Thank you, Madam Chair. We appreciate that.
Thank you. Okay, I'm going to say right off the start here that I may not have this name right, so please feel free to correct me. Taze Geiser on Zoom. Taze, if you have stepped away, we'll come back and follow back up on that. Glenn Rudd, also on Zoom.
I'm sorry.
Oh, okay.
Oh, go ahead.
Okay. Great.
She can go ahead.
Great.
My apologies. Can you hear me?
Yes, we can.
Yes. I'm sorry. My name is Thais Kaiser, and I'm actually a parent of a young adult that has not only a special needs, but he has a mental illness. So my son is 20 years old. He was early on diagnosed with a developmental disability and later on with autism. And unfortunately, he also has schizophrenia. So if there's no funding for people that have a disability, there's really no funding for people that have a dual disability. However, my son has proven and defied a lot of odds. With the right support, he can contribute to society and be a productive member. Unfortunately, we can't get the now and comp waiver because he has a mental illness, and we can't get any help from the mental health department because he has a developmental disability along with autism. So it was very difficult for me to hear one of the gentlemen earlier saying, you know, we should take away the funds from these people because, you know, you don't see. I would love to put him actually in our shoes and have him spend a day to see that these kids actually do have a lot of potential. They can do so much if they have the right support. I need help, along with many other parents that are in my situation. And I have vowed to help a lot of families just kind of navigate the system, which is you have to have all the time in the world. It takes all day. I'm a stay-at-home parent, and that's all I do is I look for services for my son. And everything that I come across, I get either dual denial, or I've literally had people walk me in and out of a facility once they hear both the diagnosis. However, once they get to know my son, they fall in love with him because he's loving and caring, and he's kind, and he is an amazing individual. We need the now and comp waiver. We've applied 3 times. The first 2 times we were denied because they said his mental illnesses was causing his autism. The last time they said, hey, we acknowledge that he has autism. However, the mental illness is what's causing cognitive disabilities, which is, I've had the psychiatrist, I've had his pediatrician, the actual psychologist that diagnosed him. Everyone wrote letters explaining the situation that he does have a mental developmental delay. Unfortunately, autism is a cluster of diagnoses. And with that cluster, mental illness is one of them. They can't not acknowledge one and not acknowledge the other. And you can't dismiss these kids because they have both. So I am begging the committee at this point to please help us.
Thank you so much for sharing your comments. I am sure that, just as you said, that you have an amazing son and that he is fortunate to have a mother and advocate like you to continue to search for resources. Are you on the Now and Comp planning list? Is your name there?
No, we were denied again the 3rd time because of the fact that he has a mental illness. So, but unfortunately, the Department of Behavioral Health can't do anything for us because he has a developmental disability. So we're stuck. I am now having to hire an attorney. Everything within my son I've had to involve an attorney somehow. And it is just a struggle. It's like pulling nails from everyone. I do everything. So when I heard the gentleman saying that, you know, us as parents need to step up and do more, I do everything. I get my son to places. I'm the one that's fighting for him. I'm the one that's filing for all these paperwork because he can't. He even though he's 20, mentally he's about 13. He can't sign any of these forms. He reads at a 1st to 2nd grade level. However, despite of all these challenges and the diagnoses that are autism and schizophrenia, he is not violent. He is kind, he's caring, he loves animals, he loves to help other kids like him. And I find that he has a lot more heart than, you know, most human beings walking around. I actually feel like he has so much more to provide that a lot of us could learn so much from him. Just a little bit more empathy, just a caring, you know. For example, my neighbor, she had to leave and go out of town, and she has her little dog, and he was there all day, every day, making sure everything within that dog, you know, that dog didn't miss a thing, didn't care for, didn't need a thing. I don't see most humans doing that, you know. It just baffles me that the very dynamic of people that can't speak for themselves, that you guys are willing to shun them away and not provide them the care that they need.
Where do you live in Georgia?
I live in North Fulton. I'm in Johns Creek.
In Johns Creek.
Yes.
Okay. I want to ask you to, after this, if you could send me your contact information, your email, possibly. We may have it. Do we have that, Amber? We have it from sign up, so do not worry about doing that. We're going to try to follow up with you and see if there are any resources. We'll work on it. Okay?
I've tried. This is what I do. Again, I'm very fortunate to be a stay-at-home parent because it allows me to dedicate all day, every day to do this. So if there is, I would appreciate it. But as of right now, there's not. And the only one that is available, which is the Now and Comp, which would be perfect for him, they have denied him 3 times.
Okay. We're going to check on, see what we can find out. Thank you so much for
Thank
sharing
you.
your story with us.
Thanks.
Glenn Rudd.
Hi, my name is Glenn Rudd. I live in Fulton County as well, also in Johns Creek. Thank you very much for your time today. I just kind of want to echo what Mr. Jacobson said. in terms of people on the waiver list. My daughter's 28 years old. She's been out of school for 6 years. She has autism with mild to moderate ADHD. I don't know if you can see my background there. She's very social. She loves people, but she has difficulty staying on task. She works well with a peer. She goes through a job training program right now in Roswell, 3 days a week, and because that's all we can afford for her without the waiver. She's been on the waiting list since 2014, and like I said, she goes there 3 days a week, and she does great while she's there. And the other 2 days she stays at home because my wife works from home those 2 days, and things kind of change with her behavior and whatnot during those 2 days. So she kind of takes a step back every day that she's home. So basically, we're full-time caregivers with limited respite. We both work full-time. We need to work towards assisted living since we're both, my wife and I are both in our 60s, and my daughter has no siblings. And we need to get her to be more independent, but she needs help in doing that. One thing to point out, and this is not anybody's fault, but we've had at least 4 caseworkers due to the length of time and high turnover within the department, which basically requires us to start all over again with a new caseworker every time we get re-engaged in this and start working on it again. So, my comment also is that 100 slots is not enough. And the other part to that is, these kids have a lot of, I call them kids, because there are kids. They have a lot of possibilities. Sorry, if we give them the chance. I also wanted to point out to the woman who was in front of me, thank you very much for what you're doing. And if your child, by any chance, wants to get involved in the Special Olympics, there's a Special Olympics program called Special Ks, which is in the Johns Creek area. The city of Johns Creek Police Department does a great job supporting them. And so look them up on Facebook if your child can participate in any sports that they provide. So again, thank you very much for your time. I just wanted to, again, support or suggest the idea that 100 new names per year is not enough. We've been waiting a long time and we really need the help. And thank you very much for your time.
Well, thank you, and thank you for sharing the photo of your daughter and also the suggestion of the Special Olympics and Special Ks program. That's great.
Yeah, I'd love to give a shout out to the city of Johns Creek. They do a great job supporting the program.
Good. We'll kind of put that in our file and try to help some others be aware of that as well.
Excellent. Yeah, we always need more kids. We got a flag football program now, working on other sports all the time. So we can always use help from volunteers as well as from participants.
Thank you so much. You have a good evening.
Thank you.
Okay, next, and I might not get this name right, Ratil Shepard. Ratil is not online. We'll check back in a little bit about that. What about Keisha Austin?
Hello, everyone. Thank you for inviting me. I have 2 special needs children. We're here in Cobb County, and we have applied for assistance for certain things like the now and comp waiver. Our daughter is getting ready to go into the KSU hold on one second. The KSU program that allows her to be able to have the social and learning growth program. We've applied on several different platforms to get, assistance just to help. But to the gentleman, as Mrs., I know I'm gonna pronounce her name wrong, the young lady before me, to address the gentleman who indicated that parents don't do enough. I do part-time work, but at the same time, I am a stay-at-home mom, the other parts. And we're continuously looking for information. We're continuously putting our children in different situations so that they can get exposed to different things. So it's not like we're sitting at home twiddling our thumbs thinking that someone is going to save us. We're trying to prepare these children for when we are leaving this earth so that they can be as independent as possible. So unless you have, or in our shoes, you really don't know if those parents are doing enough. So in essence, I was very offended by that statement. Very offended by that statement. For you, as someone who represents our state, should have enough empathy to understand that someone is not just sitting around thinking, what can I get for free? But back to what I was saying, Your Honor, ma'am, it's the fact that we are in need of help. The teachers are in need of help to provide a better understanding of communication for these children who have potential, but really don't know how to reach their potential. Parents need training in order to help their children reach that potential, along with organizations need help on how to help parents help their children reach that potential. No one signed up for this, but we're making the best out of this situation we possibly can. To all the parents who are on this platform right now, to all the people who have some dealings with special education, special needs, mental health, whatever the situation may be that causes them not to be considered atypical, we are not sitting around thinking that someone is here to save us. We are putting our foot on the ground, we are researching, we are filling out, we are sleepless nights trying to make sure we provide the best opportunity for when we leave this earth. So now ANCOMP waivers do need funding. We have been on this list probably for a couple of years, and I filled it out before she even left high school. But I am steady trying to find scholarships or organizations or anything that can assist her getting into this program, or things that can help her develop all of the necessary tools she needs in order to be independent. Not really sure if this is answering your questions, but yes, now comp waivers are needed. Yes, there's more funding that is needed to help the parents, because if you help the parents do not have a problem in helping their child. And I don't know if I'm supposed to say rest my mic. I don't know what it's supposed to be after that, but I'm just putting my mute button on. But thank you for my opportunity to speak.
Ms. Austin, thank you for speaking to us, for sharing your heart. Thank you for being a good mom and finding the best opportunities you can right now. That KSU program is wonderful, so I hope that will work out for you and that you will continue to champion the needs of Now and Comp. Appreciate you. Thank you.
Thank you.
Next is Julie McGowan with the Advocacy Office, also on Zoom. I think she has stepped away. Okay, we'll come back. Tanit Myers.
Yes, greetings, Madam Chair.
Great. We can hear you.
Are you able to hear me?
We can.
Yes, ma'am. Greetings, Madam Chair, Dempsey, and committee members. My name is Tanette Taharka Myers, and I am a resident of the 165th District of Georgia that's located in Savannah. And I would like to start out, I would like to express my thanks. I am one of the 13,000 parents that after multiple applications was able to successfully obtain Now and Comp funding for my son Cameron. And I learned from the commissioner's statement earlier that he is one of 13,000 Georgians living with intellectual and developmental disabilities that was able to obtain this funding. And I wanted to add in my comments to the committee member that had the question about assessing individuals that receive those waivers. After multiple applications and years of applications, you do, once you are selected and receive a waiver, there are processes monthly that you have to go through to make sure that you are in compliance with the waiver once you have an individual that receives it in the state of Georgia. And as well as training that the parents and caregivers have to go through, and support coordinators at the time before COVID would make residential or home visits to actually see the individual that's the waiver recipient, and also confirm and verify what they were doing with the dollars. If you are not in compliance, regardless if that individual that's a waiver recipient passes away or not, you can lose your waiver funding. So I don't know if you committee members you're aware of that, but there is an individualized service plan that is held every year that has to be conducted at least 45 days before the waiver recipient's birthday, and you have to go through that process. So the parents that are speaking that are still on the waiting list, the work does not stop when you get the waiver dollars, and I know they realize that. My son Cameron is 29 years old. He did not do anything wrong. I did not do anything wrong. But life happens. And again, with the research and advocacy work, we're here and we don't stop, because our children are individuals, they are adults, they become adults, and they are members of the state. They are Georgians. They are fellow members of the state, and they deserve the respect, and these parents also deserve the respect that we are getting today. I'm so thankful, like I said, for this opportunity. And let me just get back on my notes. I apologize. It's just that I hear such impassioned parents, and I want to encourage them to keep pushing and going forward. But as I stated, the now-comp waiver has allowed my son Cameron to overcome many of his challenges that he faces daily with his medical diagnoses, and it allows him to be a participating, active member in his community. What I would like to request is the continuation of funding for the individuals that receive the now-comp waiver, but the expansion of funding for the over 7,000 individuals that continue to sit on the waiting list. This funding will, like I said, help fellow Georgians that are in critical needs of various medical and community-based resources that each individual living with intellectual, developmental, and developmental disabilities need in order to obtain their independence. I thank you so much for allowing me the opportunity to participate, and hopefully once this pandemic, once we get beyond this, you'll actually be able to see individuals. We would participate in Disability Day activities at the state capitol. We would travel from Savannah, and I'm sure I'm not the only one. I'm sure those other 13,000 family members that received the now-comp waiver would like to come and share their stories, and also would like to say thank you. But we need more. We need additional support, and I participated as a panelist in a Disability Day advocacy program just last week. And I apologize for not having the state senator's name, but there was proposed Senate Bill 208 that talks about fully funding the waiting list in 5. It's called Fully Funded in 5. And I would gladly be willing to share that information with any of the committee members, as well as any of the procedures and processes that individuals that currently receive the now-in-comp waiver have to go through, not only on an annual basis, but monthly basis, to make sure that the individuals that have been awarded are doing what they need to be doing in compliance with the state to make sure that the dollars are being used appropriately. Madam Chair and committee members, thank you so much for your time. Thank you.
Thank you, Ms. Myers. We appreciate you. I look forward to you being here. I hope I'm here too, and that I can meet Cameron one day.
Great. He would really love it. Thank you so much.
Thank you. Next, also on Zoom, and I think this, unless we go back afterwards, if This may be our last Zoom person. The rest of you are here in the room. So, Allison Hernandez.
Hi, thank you so much for letting me come and speak. I am also a parent, and I actually didn't prepare anything formal, but I did send my testimony, and I'm a 46-year-old single mother living in Lawrenceville of a beautiful, if you guys are actually looking at the screen, beautiful 10-year-old daughter with cerebral palsy and a rare form of epilepsy. Sorry, we're very passionate. I'm going to try and keep it. She's been on the Now Comp waiting list since she was 7. She's going to be 11 this year. We are not eligible to get Now Comp right now, according to the people that I have spoken to, because she's eligible for other programs, and we do have some services under some other programs. For example, we have the Georgia Pediatric Program. We have 64 hours of care taking time that we should be able to access. Unfortunately, because not only of the crisis with the caretaking situation, but also just because of the bureaucracy it takes to get the caretakers onboarded, and that's through the GAP policy as well as through the policies that are for each of the provider agencies. It makes it virtually impossible to get people onboarded in a reasonable amount of time to come and help my family. Now, as I said, I'm a single mother. I'm also a full-time federal servant, and I work from home. And I am completely overwhelmed at all times because of all the things that I have to do as a full-time working mom of a very demanding job, both for my motherhood job and for my civil service job. I have a lot of I'm a policy writer, and I have a lot of really strong thoughts about what things can be changed. For instance, I believe that there need to be some policy changes that make sense to the things that are existing right now. There could be a lot of policy changes that could be made that would make a lot more sense for our families. You know, like I said, the programs that we are eligible for right this minute and are not eligible for Now Comp because of the eligibility under other programs, they're not working. Like, it sounds like I should be very happy and well off with my 64 hours, but they have never even been able to fill half of that for us. And I have helped with that, you know, trying to seek those people. And it's just there are too many hoops for us to jump through. And working a full-time demanding job, it's extremely taxing on parents like us that are trying to do right by the community, and then make our children also become good, upstanding members of the community. And, you know, it's a true struggle every day. There's no way to describe it any other way. It's a true struggle, and none of us parents want to be doing this. We would rather be doing the same thing that you guys are doing, going to work every day, you know, driving in the commute and complaining about traffic. And that's not stuff we even worry about, because like we have real struggles that, you know, that we are advocating for, because it's a thing that a lot of people just can't really grasp because they don't live it. And so as a parent and as a person who understands many levels of government and policy and bureaucracy, I offer my assistance and expertise in anything that I can. You know, it's a very hopeless feeling to know that there's so many slots that are not filled on the Now Comp, because, you know, it's hard for us to even, you know, have a voice, because most days we're so exhausted to even come and do something like this, to come and speak on what the reality is, that I hope that rings through, because these people are not doing this because they want to get a free ride or because they just want money or whatever. They are doing this because they want to help their family member that they love. And my daughter is very smart. And I hope I'm going to hold it together. I really do hope that she will have the opportunity that she deserves someday. And I will continue to do this until the day I die, because I really want a better world overall and a better life for her. And I hope that if any of you are parents, that you can relate to that in any way possible. Because everybody wants their children to succeed and do well. And that's what any of us are out here to do. And again, I do offer myself up as whatever resource I can be as a parent of a, you know, as a single parent with no other family that is able to assist me. So I do all of it, everything, day in and day out. And, you know, I deal with things like transportation that, you know, can't keep my daughter safe, and she can't defend herself. And so I have to take her to and from school because the school system was not able to keep her safe. And so, you know, it's just daily things like that that are real. And I'll stop now, but I thank you for listening, and I truly appreciate whatever efforts can be made to help fund these families that really, truly need the help that they are standing here and trying to advocate for.
Ms. Hernandez, thank you so much. Thank you for sharing your heart and your story. And I do hope your daughter does have that opportunity one day. You've said very encouraging words, though, for others to also persevere through the process, that it is not easy. So thank you so much. I'm going to note your name. Now, if you're ever here at the Capitol, or if you ever see something we need to do, we'll keep trying, but please do stay in touch.
You can bet on it.
Thank you. Okay, Polly McKinney in the room.
Hi, I'll read very quickly because I know it's late. Good afternoon. I'm Polly McKinney, Advocacy Director of Voices for Georgia's Children. We are a whole child data-driven policy and advocacy organization, and thank you for the opportunity to speak today on the FY23 budget. We would like to respectfully request $5.86 million for annualized funding of the Georgia APEX program, which the Commissioner referred to earlier. For those of you who are not super familiar with APEX, I put the agency's fact sheet in your folders, or gave it to Amber. But it's Georgia's own program. We've developed APEX on our own. It's incredibly successful. And we understand that this funding would be needed to ensure that the current level of APEX programming is maintained and can continue to build capacity for access to mental health services for school-aged youth, pre-kindergarten through 12th grade, throughout the state. I'll just take one moment because I know the Commissioner didn't mention this stuff. But for those of you new to APEX, it's a partnership between community-based mental health providers and local school districts, and is supported by the Department of Behavioral Health and Developmental Disabilities. It began around 2015 and is now in 731 schools, representing 33% of all schools statewide, 69% of school districts, and 73% of all counties. And the Commissioner said a number I didn't know, but I'm going to reiterate it. 58% of those are in rural areas. APEX provides early detection of child and adolescent behavioral health needs, improves access to mental health services for kids, and promotes increased coordination between Georgia's community mental health providers and local schools and school districts in their service areas. Kids are usually referred to APEX due to classroom conduct, behavior outside the classroom, and depression. Those are like the top three. As the Commissioner said, 15,607 students used Apex last year, and a third of those kids got services there for the very first time. We know that untreated behavioral health challenges in childhood and adolescence can lead to drug and alcohol use, violent or self-destructive behavior, and low educational attainment. And of note is the fact that in Georgia, suicide is the third leading cause of death over the last 5 years, following car crashes and homicides for children 1 to 18. And obviously, COVID has only exacerbated the mental health situation in our schools and for our kids, and so we just want to keep Apex going and going as well as it has up to now. Thank you once again for the opportunity to present, and I'm happy to try to answer any questions.
Are there any questions or comments from the members or online? Not seeing any because you do such a good job. Thank you, though, for reminding us. It's so important that we do think about this very successful program.
Thank you so much.
Appreciate it, Polly. Next, we have Diana Wellish with SPAD.
If I could hand these and pass them down. Good afternoon, Madam Chair, committee members. Late in the day, so again, I will try to be brief. I feel like I've become the professional beggar on behalf of individuals with developmental disabilities, intellectual disabilities in Georgia. I'm Diane Willish. I'm the CEO of United Cerebral Palsy of Georgia, and I also serve as the administrator of SPAD, which is the Service Providers Organization, Association for Developmental Disabilities. Came to kind of emphasize the commissioner's discussion about the status of the workforce in the state hospitals and in all of the programs that they are responsible directly for with their own employees. We spoke on the amended budget as well about the dire circumstances that all of your community partners that support individuals with IDD are facing. The situation is grave, it's a crisis. I've told people it's of epic proportions. I've been doing this work for 40 years and never have dealt with the circumstance that we find ourselves in. The handout that I gave you kind of speaks to the status that we're in. You were gracious enough last year to award us a 5% across the board increase in home and community-based services for this population in the now and comp waivers. We have yet to receive those dollars through an array of complications due to federal level kinds of things, no lack of effort on the part of either department. It just has not come to us yet. We have, many of our members have benefited from some of the federal programs back in the beginning of COVID, but those dollars have waned and are no longer there. And to address a question that Representative Oliver brought up about the governor's COVID relief dollars, those dollars that might be available for community-based organizations to apply for. Our organization applied. We have not heard back yet. It's a very narrow eligibility of who can access those dollars. So for most of our members in community services, they would not even be eligible. So it's a sliver of our membership or like organizations that would even be eligible. If we applied, met the deadline, we know nothing at this point about whether we'll receive that support. I think the shocking part about this is that we are so happy for all state employees to get a $5,000 pay increase. Absolutely well-deserved. State employees are not paid their value, so that we don't take issue with. But I was sitting in the back doing a little arithmetic while the commissioner was speaking. That $5,000 raise amounts to about $2.40 an hour for a full-time direct care sort of person. Our hourly rates for now and comp services are based on a rate study that was done 2015, I think, and that rate study determined that the hourly pay back then for a direct support professional, a DSP, was $10.62. If we take that $10.62 and add the 5% that you generously awarded us last year, that gets our DSPs to about $11.15. Another 5% this year, which is what we're pleading for, would get us to about about $11.65, $11.70. This is still not a viable, livable wage. It will begin to address what we're looking to do is try to stabilize our workforce. We know there is a new rate study on the horizon, but we need help now. We are desperate. Some statistics that I think should be shocking, and thinking about a loved one that needs a caregiver, whether it's your grandparent or any loved one that needs a caregiver. In our work, the most recent statistics or data reveal that 47% of the staff turn over every year. So that means essentially that 50% of the time that you get care, you're getting it from a strange person that you never met before. In addition, only 46% of the individuals who provide the care have been there more than a year. So essentially, 50% of the time they're very green and new, and the other portion of those people are people who have less than a year's experience. Not to say that they're not valued, and we want to keep training them and getting them up to real experience, but supporting individuals with disabilities requires understanding a lot of historical information about them, as well as being able to understand them, because often they can't communicate their wants and needs to you. They can't tell you when they're not feeling well. So we need skilled, stable staff to provide the quality of care that they and the citizens of Georgia rightfully deserve. The other kind of point I wanted to make, just to give you some concrete examples, and I think my colleague, who's also a SPAD member from the ARC in South Georgia, talked about in her organization, we are paying for 2,000 hours of overtime, a pay period every 2 weeks, and a third of our DSP positions are open at any given time. We can't compete, we can't recruit, we just need help to do the job that we committed to you all to do as part of the Department of Justice settlement, to take people out of institutions and have them lead a rich life in the community. It's, we're at a crisis that I don't know how any more to explain it than that. We've talked about workforce for a decade, but we're really at a tipping point, a serious tipping point. Happy to answer any questions. I know I sound like a broken record about this.
No, you sound like very factual. Is there any questions or comments from the committee or from anyone still online? Okay. So thank you. You gave us some great information. This is a great sheet for us to have as we go into the process.
Thank you. Yeah, another 5% would help make an enormous difference, help stabilize till we can get a new rate study and funding for that. Thank you very much, everyone.
Thank you for all that you are doing in spite.
Appreciate that. Thank you.
And next we have John Rice, maybe Christopher Crusade. Is that great?
Thank you, Madam Chair and committee members, and like the other speakers have mentioned, I know it's late, I'll be brief. I'm here in behalf of my son, our son, Christopher Wolf, who died in February of 2016 after a 16-year battle with substance abuse and opioid addiction that started with a hospital prescription. And you'll think about this timing because it was right about the time that Purdue Pharma was introducing OxyContin, and that was the drug that led to his addiction and ultimately his death. We saw in his journey with repeated attempts to rehabilitate how unsuccessful they were for him. They are for some people, they weren't for him. And we saw in his journey the lack of information that my wife had, who was a single parent at the time, the information about the risk of opiates, the risk of addiction, and the opportunities for alternative pain management strategies. You know, the pill is easy. There are other ways to manage pain, but they aren't taught, and it's easier to prescribe. And that leads us to the situation where we are today. So we started the Christopher Wolf Crusade, which my wife is the CEO of, 2 years ago, because we thought that more effort needed to be spent on prevention and education and the link with mental health. 50% of all people who abuse drugs have a corresponding mental health issue. Rarely do both those comorbidities get treated. So we introduced a new position in healthcare called the life care specialist. The first life care specialists have been working right down the street at Grady for the last 2 years. They work as members of the care team with the nurses, with the doctors. Their job is to educate patients and their families so that they understand the risk of the pills that they're taking. They understand alternative pain management strategies so they don't have to take pills. And they do everything to follow up. So their follow-up period is a year. And during the pilot program, we've seen a 25% reduction in opiate prescriptions. And the pills that used to sit in the pill closet back at home and possibly be stolen or sold or shipped off to somebody else now get returned and disposed of properly. So the pilot is working. The pilot's in the orthopedic trauma unit because our analysis was that the orthopedic departments are where most of the people get their first prescription drug. And you probably know this, but 30% of the people who die from a drug abuse overdose started with a prescription drug. So it is the beginning of a cascading effect. So these people are a member of the care team. The next step for us, and what we're asking for, is we're submitting a proposal for $1 million to expand this effort to rural Georgia. Because the problem in rural Georgia, and I don't have to tell this to anybody on this committee, is as bad or worse than it is here in Atlanta. We're partnering with Gene Sumner, who is the dean of the medical school at Mercer, who called us up and said, I've heard about what you're doing, and I want to be your partner for rural Georgia. This lends itself to exactly that. We can hire people in rural Georgia, train them to be life care specialists, to be in the clinics, to be in the homes, and do something to prevent substance abuse. Saturday is the anniversary of Christopher's death. 300,000 people have died since he died. This is accelerating. It's not stopping. 20 people have died in the 2 hours that I've been in this room. This is a real problem. We can do more to help it by focusing some resources on prevention, and I am grateful for your time today. I know you have lots of difficult decisions to make in terms of how you allocate the state's budget resources, and I appreciate your consideration for this effort. Thank you.
Thank you. Are there any questions or comments? Do you have a website? You've got some information to leave with us?
Excellent. And a website, and
thank you.
And the commissioner is well versed in what we're doing. Commissioner Fitzgerald.
Wonderful. I saw her. I saw the two of you speak, so I figured she probably was. Appreciate it.
Thank you very much. Thank you, sir. Thanks a lot.
Thank you. Next, Amy Hughes. It is freezing. It keeps you awake. That's what we do in here.
Actually, I think my foot is numb walking up here. Thank you very much, Madam Chairman and committee members. My name is Amy Haywood Hughes, and I'm here on behalf of the Matthew Riordan Center for Autism in Savannah, Georgia. I'm with Hughes Public Affairs, and they're one of our clients. And we partnered with the state, with Dbhdd since 2006 to serve children on the autism spectrum and their families. I found the comments earlier from the parents very powerful, because it reminds you of the struggles that families have as their children experience these challenges. Well, the Riordan Center, just to remind some of you who might not know, it's the only year-round day school program for children diagnosed with autism outside of the Atlanta area, and they serve children across Southeast Georgia. And in addition to the school, the Riordan Center's advocacy and outreach programs provide autism-related instruction and training to family members, educators, therapists, and other professionals such as law enforcement officers, as well as to individuals on the spectrum. So as we discussed at the supplemental budget hearings, the pandemic was especially difficult for children who were on the autism spectrum. And through it all, the Riordan Center remained open and to make sure that the children's educational needs were not interrupted and that they were served. But as you know, the move to virtual instruction in a lot of schools resulted in a surge of inquiries and dramatically increased the waiting list for services of families asking for assistance and also to move their children into the school. So as a result, the Riordan Center would like to put in an appropriations request in the FY23 budget to add one additional classroom of 9 students so that they can reduce that waiting list in order to serve more children and their families. I do want to say that we're extremely grateful for the funds that this committee found in the supplemental budget to help restore some of the FY2021 austerity cuts. As you recall, there was a $67,500 cut in that a couple years ago when all the agencies took a big hit. And we appreciate what you did. We're working with the Senate so that they match those funds. But we also respectfully request that as you look at this budget, if you can restore those cuts fully, that $67,500, that would be appreciated. So that total request would be a $200,000 request for the Matthew Riordan Center in the FY23 budget in the Dbhdd contract for them. I want to thank you for your consideration, and I want to thank you for what you do up here. I think this is perhaps one of the most important committees at the Capitol, and also one of the most difficult as you wrestle with these, because I know you want to support everybody, so thank you. And if there aren't any questions, there is a delegation letter for you from the Coastal Georgia legislators, as well as a one-pager about the Riordan Center, and I'd love to invite you to come visit anytime you're in Savannah. Thank you.
Thank you so much. I am not seeing any questions, but we're well aware of your work and grateful. Thank you. Okay. Next, we have Laura Whittaker with ESP and team, whoever. Laura will be new to us, but she does some great work in our state.
Woohoo! I feel like I won. Thank you, Madam Chair and committee. What an honor to be here. This is ESP's first time coming to request support and to share the magic of what we do every day for the population that we serve. I want to start with, in your packet, you have a picture. And there are 700 stories just like this picture, but I want to tell you one because it's going to share a little bit about where we are headed. This little girl right here, her name is Jennings, and Jennings is almost 5 years old. She spent the first 4 months of her life at CHOA, and hooked up to machines and being taken care of by amazing NICU nurses at CHOA. After her 4th month hooked up to those machines, they decided that they needed to either suspend care for Jennings or take her off of the machines. And so they went to the parents and they said, okay, what do you guys want to do? And her dad said, you know, we want to go ahead and remove her from the machines, but I want to take her outside to the garden. She's never seen the sun, and she's never seen the clouds, and I cannot bear the thought of her living another day without seeing the sky. And so he took her out to the gardens at CHOA, little 4-month-old, and shortly after that, she began to breathe on her own. And it was many years of care that this family began to enter into the world that you guys have heard about a lot today, of you have entered into the world of caring for a child with a disability and all that comes with it. Physical therapy, occupational therapy, speech therapy, hospital visits, doctor visits, all of those things. What's beautiful about Jennings is that when she was just a baby, she visited one of our biggest fundraisers called Big Hearts. It's a night where we celebrate people of all abilities in Athens, Georgia, in front of 3,000 people. And as her parents sat there and wept, they knew one day Jennings would have the opportunity to go to ESP. Jennings' family lives 3 hours away from our home base in Watkinsville. And this past summer, her mom booked a hotel room for 2 weeks and brought her and her younger brother to Athens, Georgia, so that she could experience what every kid desires to experience in that summer camp. 3 years ago, her dad shared she could barely hold up her head. And just this past summer, she had the opportunity to ride go-karts, to zip line, to get in a pool, to be loved and accepted, to be with friends, to be buddied up with a college student who could hold her and engage with her. And 2 months after her first experience with ESP, her parents packed up everything that they had and they moved to Athens, Georgia. You see, her parents had not had a night out since she was born. They had not been on vacation or had a date night. They had not gone to a party. And because of ESP, since they moved this past fall, they've been on 4 dates. They went to 2 Christmas parties. They went to a few UGA games, all because of the support that ESP provides. ESP exists to create transformative opportunities for people of all abilities and their families, and we are seeing that it's changing communities for the better. ESP has a 35-year history of serving individuals with disabilities. I started my journey there, like many do, as a 19-year-old student at the University of Georgia. Shortly after that, our founder was diagnosed with pancreatic cancer, and I took over as a 19-year-old and finished my undergraduate degree and graduate degree all alongside being the executive director of this amazing place called ESP. We served 40 participants at the time. We now serve 727 individuals from 38 counties throughout the state of Georgia. And we're just getting started. We do this in 3 different ways. You'll see on your packet, we do this in 3 ways, 3 programs. We have our 360 program, which if you have a child with autism, they can come and play baseball at ESP. If you have a child with cerebral palsy, they can come and be a ballerina or do yoga. If you have a child that has any type of physical, mental disability, you are accepted and loved, and more than that, celebrated every day in the afternoon. A key component of this, and I know you've heard a lot about this, is family support. Families like Jennings don't get a caseworker when they're born. There's no manual to tell them how to do that. But the minute they start a new family meeting at ESP, they have someone to call and someone to lean on. They have a family beach trip where a parent of a child with cerebral palsy can go to the beach with their child and be supported and meet another family of a child with cerebral palsy, all together in one community. The second program that we have is Java Joy. Java Joy is a mobile coffee cart that employs adults with disabilities, spreading joy. We do this all around the state of Georgia and beyond. 87% of adults with disabilities who want and can work are unemployed. And we provide these services without the support of any waiver, without the support of state services and state funding. We provide this service to over 70 Joyristas throughout the state of Georgia. That's a joy plus barista equals a Joyrista. And last but certainly not least is what Jennings experienced this past summer, which is our Hooray Camps. And that's an opportunity to keep families working throughout the summer while providing kids of all abilities the opportunity to experience a typical camp experience. So who do we serve? Out of those 727, you see the statistics. In your packet, there's different counties and the county breakouts. But the beautiful thing, and the thing I want you to hear me say, is that we never have turned away a family. Not because of economic impact, not because of COVID, not because of their own financial standing, not because they don't have a waiver, not because they have too difficult of a disability. We have never turned a family away at ESP. When the schools couldn't support them during COVID, we did. When the state hasn't supported them, we have. We've provided food, we've provided shelter, we've provided support, and all of this on our own through the generous support of our communities. The important thing to know about Jennings is that her family could afford to pack up and move to Athens, Georgia. There are thousands of families throughout the state who, when they get a taste of what ESP is, would die to move to Athens, Georgia. And we know that, and we've seen that. And because of that, you'll see in your packet that we are working to grow. We don't want to just serve individuals in Athens, Georgia. We want to serve the entire state and beyond. We currently have Java Joy in the Atlanta area. We have it in Rome, Georgia, and we are soon to be headed to Gainesville, Georgia. You see, Java Joy is the key that unlocks opportunities for 360 and Hooray Camps. So we envision all three of those programs being in future cities throughout the state so that families like Jennings don't have to move 3 hours away to receive the magic of what they experienced last summer. We have interest from Savannah and Augusta as well, individuals who have seen and experienced ESP and want it in their communities. So I'm here today just to shed some light on what we do. Many throughout the state know what we do. They assume we're a national organization or a state-funded organization, and the truth is we're not. We've leaned on our own communities for 35 years, but we know in order to grow, in order to serve more families like Jennings families, we're going to need your support. We're going to need your help in order to do that. And we are excited to request today and in the future the support of future cities. We ask for a total of $400,000, which will give us $10,500 per county to support the individuals that we have, around $100,000 for each of the cities that we will be in fiscal year 2023. I want to end by mentioning that this picture was taken just yesterday. The University of Georgia football team, our national champions, showed up because of the love of ESP that they have. And this is Jonas, one of our leading defensive players, holding Jennings. ESP is so much more than just a service to the people that we serve. We are teaching and engaging people throughout the community, young children all the way to football players, on how to appropriately engage people with developmental disabilities, and we're truly changing communities for the better. I want to thank you for the opportunity to speak today. Again, thank you, Chair, thank you, Committee, just for the opportunity to shed light on what we do every single day and what we've been doing for 35 years.
We do have someone who wants to say something, I believe. Representative Donahue.
Thank you, Madam Chair. I understand that you know one of the renegade representatives here, Marcus Wiedauer.
That's correct.
And he's a great guy, a good friend. Gainesville, give me an idea. That's my district. And what part of the area will it be built? When should it be opened?
That's a great question. So it starts with the mobile coffee cart. So we actually don't have to have a physical location. We need a location to brew and have our meetings and things like that. And I don't think that's been identified yet. We have the Vintons and the Eccles both working to help champion this. And we're hoping in the next 12 months to launch the Gainesville Java Joy opportunity. That Java Joy opportunity will be our first opportunity, and the first year to 2 years we'll just focus on employment for adults with disabilities. And then we'll begin to tell the community the story that they need more than just employment. They need wraparound services where we can provide them with after school, with classes, life classes, and also with summer camp. So that's kind of how that works, and we'll gradually roll it out. It does cost about $500,000 total for us to come to a new city, for us to oversee that, buy all the materials, all of that. So the Vintons and the Eccles and many others are all a part of that hope for the Gainesville area, and they have shared with us that there is not anything for, if you're 4 all the way to 21, there's really nothing for kids with developmental disabilities in the area. So they're really excited about the future and bringing the whole ESP program to Gainesville.
Thank you.
Yeah.
Are there any other comments or questions? Anyone online? Not seeing any. You've given us some great material to think about.
Awesome. And this is a magnet, so you can put it on your refrigerator. Remember Jennings. Thanks.
Okay, next we have Sheila Keller. Great.
Good afternoon. Thank you for the opportunity to speak to you today. I drove from the rural, lovely county of Burke County, so that was about a 2.5-hour drive through the wonderful Atlanta traffic. I would like to tell you about my beautiful daughter, Akelia. She was born with a genetic condition known as Dbhd. This genetic abnormality causes her autism, intellectual disability, pervasive anxiety, and emotional lability. So this will be a permanent, lifelong condition for her. In addition to this, she was abandoned in her first year of life and left alone for 4 days with no food, water, or parental care. She came into my home at age 5, and her adoption was finalized when she was 7. Since that time, I've worked diligently to find and access the supports she needs to be safe, healthy, and happy. 3 years ago, she was hospitalized in a psychiatric residential treatment center, and she was discharged back home, still fairly unstable and unsafe. At that time, I was told that Dbhdd would provide support for her at home. So I filled out the multitudes of paperwork. I provided the requested documentation of her disabilities and her diagnoses, and then I began to call Dbhdd repeatedly, attempting to access the help that I had been promised. For 3 long years, as I struggled desperately to keep her safe and stable at home, there was no help available. And I would just like to comment also with the other parents as far as what we are doing. We are on the phone every waking moment of the day. We are talking to our child's therapists. We are fighting with the school system, asking them to provide education for our children. I was only able to work part-time, and I worked nights so that I could devote my days to the care of my daughter. Last year, my daughter's mental health deteriorated even further. She was hospitalized multiple times in crisis, becoming a danger to herself and others many times. After 8 long months of intense anxiety and stress, she was finally admitted to a psychiatric residential treatment facility again. However, she was forced to discharge when she turned 18, and the hospital informed me they would send her to a homeless shelter. And I do feel like many of the homeless people that we see on the street are there because they have intellectual and developmental disabilities that they cannot manage on their own. After weeks of many, many phone calls and emails, and with the help of the Georgia Advocacy Office, Dbhdd agreed this month to grant my daughter waiver services. We are just getting started with this. I don't know who her support coordinator is. I really don't know any much about that part of the process. So, as one parent mentioned, I guess I will be getting into the next phase of advocating for her. While I am extremely thankful for this long-awaited help for her, I am also deeply disappointed that now, due to my compromised health, she is unable to return home to live with me. If we had received help when it was so urgently needed, she may have avoided hospitalizations completely last year. She may still be living at home with me where she belongs. So that's one snapshot of what happens when people with intellectual and developmental disabilities do not get the help that they need. I also would love to provide feedback as far as some of the other gaps in the systems of care. The school did not, they literally told me to my face that I should homeschool my daughter. They would not service her. Mental health, we had therapists come into the home and provoke my daughter into aggression and then press charges on her. The therapist threatened me then as the parent. So that's one of the most devastating experiences for me as a parent. Besides the day-to-day challenges of living with the struggles that my daughter experiences, when the professionals who are being paid to do a job, to support us, to help us, actually seem to be working against us and are not providing the support that we need. But today I would like to ask you to please fund waivers for the people waiting for the supports that they need to remain safe and successful in their home and community. And please remember, these are indeed real people who need and deserve this help. Another concerning thing that I have observed is that often the policies and procedures that have been outlined already are neglected, and if those policies and procedures already in place would be followed, we could avoid some of the more serious consequences for these vulnerable people. So thank you very much for the opportunity to share with you today.
Thank you for sharing your story, and thank you for being here with us and patiently waiting. Elizabeth Apley.
Thank you, Madam Chair, members of the committee. Appreciate your patience. The work of this committee cannot be overstated. You deal with incredibly important issues, and you have, in fact, been the leaders in advocating for people in this state for a long time. So thank you. You just heard the last speaker talk about her daughter's homelessness. You heard the Commissioner of Veterans Affairs talk about homelessness. I know how deeply you're concerned about this issue, and I know you understand the interrelationship between chronic homelessness and mental health issues and substance use issues, and they're inextricably intertwined in the ability of House Bill 1013 to be successful in carrying out its mission. If we don't adequately fund mental health services and substance use services, 1013 cannot succeed. It cannot fulfill its promise. So we support and thank the governor for his recommendation for a 10% increase to mental health services, core mental health services, and core adult addictive disease services, but we urge that these be fully funded. That's a commitment that we must make in order to materially change the way mental health services look in this state. So as we talk about the interrelationship of mental illness, substance use, and homelessness, I want to talk to you, and Chairman Dempsey, thank you for your question to Commissioner Fitzgerald about the housing voucher program. This is a very important, very successful program. And I want to give you a little background, which you may already have, but I want to remind you. So the governor has recommended an increase of $1.38 million in item 15.4.6, and we thank him for that. But this issue of the housing voucher program, which was created as a part of the settlement agreement between the Department of Justice and the Department of Behavioral Health and Development and Disabilities, remains one of the two areas outstanding in the settlement agreement and the extension that's not been fulfilled. At the time the agreement was made, it was to fund 9,000 people with severe and persistent mental illness who were cycling through the criminal justice system, cycling through the emergency rooms and the state hospitals, and there was a recognition not only of a denial of their rights, but of the fact that these are very expensive and highly ineffective ways to deal with the underlying problems that these people face. So this program was previously funded at the level of $27 million. It was cut in FY21 to $20.6 million. That's a 24% cut. That money has not been restored. In its December 31st, 2021 report, the department stated that it is now serving 1,889 people, and that was as of November 21st. In July of 2015, when the program started, it was serving 1,623. It went up to a high of 2,628 people being served in January of 2018. But every year since then, the numbers have declined. And it's not because there are fewer people with severe and persistent mental illness cycling through the criminal justice and hospital system in this state. These significant declines are reflected in the number of people contacted, the number of new people contacted, the number of actively enrolled people, the number of new people enrolled, and the reality is that the commissioner said she's funding her current need, but the reality is that under the settlement agreement, which was the agreed upon number of people in need of services, we are urging you to consider serving these additional 7,000 people. It costs, according to the department, about $8,000 a year on average in rent, and $1,000 for those supportive services that are so important. They are now starting to bill that through Medicaid, so it's down from the $3,000 cost that it used to be when that was exclusively state funded. And the reason it's billable through Medicaid is because, by definition, these people are disabled and therefore eligible for Medicaid. And part of what they do in the program is get them qualified and eligible to receive that Medicaid funding. So it's a simple math of an additional 7,000 people at $9,000 a person is an add of $63 million. Consider that against what we are paying to hospitalize these people, to incarcerate these people, none of which helps them to be restored to the community, to lead the kind of lives that they need in order to be restored to health. So I thank you for your attention. We realize that these are challenging questions we're asking you to address, but this is a time when we have the resources to make the change to help these people. So please support the governor's add of $1.38 million, restore the $6.4 million that was cut in the FY21 budget, and please add the funding of $63 million necessary to fully fund this program and help the settlement agreement come to closure. I'm happy to answer any questions.
Are there any questions or comments for Elizabeth? Anyone online? I'm not seeing any. Elizabeth, thank you, though.
Thank you
for championing this.
Appreciate you all.
Yeah. How about the two people that were not there? Are they still not online that were there? Okay. Is there anyone else in the room that didn't sign up that needs to say anything, wants to say anything? Well, if not, thank y'all. Thank everyone else that might be out there listening and hearing these huge stories that are so impactful and so life-affecting. I want to thank the committee. I want to thank Amber particularly for staying here, and we will all come together very soon and begin to sort through this and see what we can do. Thank y'all. Have a good weekend. We are adjourned. What time's supper? Let's go right.